Let's take a look at the Students tab, which will soon to be called Clients tab. When we click on the Students tab, you will be able to see all of your caseload here. If you are on a team plan, it will look exactly the same as if you're on a solo or a professional plan. If you are the administrator of a organization, such as what I'm looking at down here, you will be able to see and filter through all of the caseload for all therapists that are working at your organization. When you click on any of these, you will be able to quickly see their therapy record. So that's what we're calling this, is the therapy record. So the therapy record has multiple parts, and each part that it shows is dependent on what you actually have in the therapy record for this child. Now, of course, this is my demo login, so all of the names and everything not real, but let me just take you through one that has a lot more information. So this is for Han Solo. So as we're looking in here, you will see at the top, it will say the grade, the school, if it was recommended for whatever services. If it did not qualify, it would say that there. Of course, all of that follows the information is in the profile. But let me continue to show you how to do this. The manage button will basically, if you click that, it will allow you to add other therapists that are in the organization, if you're on a team plan, to the care team. Now you won't see that if you're not on a team plan. At the top, you will quickly be able to see basically the number of reports, plan of care, appointments, evaluations, any forms, linked assessments that are here for this particular client. Now, if I click into profile, I can also edit any of this just by doing this. This is where a lot of this information pulls. So like the status, the recommended for OT, let's see what else, the parent information, the exceptionality or the diagnosis, things like that are here. So like I said, you can click this again and it will collapse that area. Now, the therapy record that I was talking about, it's going to show you the active plan of care if there is one. So for this particular client, it shows that the active plan of care started here, ended here. We've got 87 days left. We have 24 remaining sessions, and this is called Session Performance Index. So that is calculated by adding your sessions. Well, so first you have to create the plan of care in OT Wizard or Therapy Wizard, but then you have to be documenting in here. And so it will create this number for you so we can track response to intervention. So more on that directly in the plan of care and the session notes videos. Again, so this was all added to the plan of care, direct, one visit, generally every week for 3 units. Of course, if you're school-based, then this would say like 45 minutes or whatever. So we're looking at a plan of care that's a medical plan of care. We look down at the short-term goals, and this is just an overview. If I want to see the exact plan of care, I'll show you in a minute, I will click into that plan of care. But this is just so you can quickly look at this before you get ready to do therapy or whatever, or you just need to see this. So all the goals are listed by the goal domain, and it will give you the first part of the actual goal. Like this one was discontinued. So if it was discontinued for some reason or mastered or active, that will show here. And then the goal performance index, which there's not one for these quite yet, but the goal performance index is how that like the progress on that specific goal based on your session notes. So if I look down here, I can also see, which we would never have this many evaluations for any child open at one time, but it does say, okay, all of these evaluations or screenings are open. This is the progress. So this was draft, it's in progress, and I can click here to continue and get right back into that evaluation. Down here is where I don't know if you can notice when I hover over it, that all of these are sort of this tealish color. This because this is the active plan of care. These down here are not marked as active plan of care. I can collapse or open each one, but the active plan of care and evaluation and notes will always be open when you come here. So this one has the ability, so if I need to print these, I'm able just to click like this. And then if I scroll down, I can export it to a PDF. I'll go ahead and do that and show you what that looks like. Hopefully I'll be in the same window. Yeah. So if I needed to export it, it will give you a little cover page, and then will actually give you all of the information that you asked for. So that's convenient for you. Also for each one of these, if there was a diagnosis or procedure code that was documented on the note or whatever, it will tell you here. It'll also tell you if it's active, if it was signed by the rendering therapist, and if a supervisor signed it. So this means that it was. Now I'm going to go on down through here just a little bit and show you the next thing on the therapy record. So all of these, if I open them up, will show you, okay, there's one plan of care for this student and this is it. If I click into it, it'll actually take me into the plan of care, just like this. And that way I can see exactly what my goals are. I can make changes there. I can look at the current level of function. Of course, like I said, this is a medical-based plan of care. So an educational-based one will look different. I'll say educational justification. Billing in units. So I would be able to go back in here and see what I had added or make changes if it hasn't been finalized yet. I could duplicate it. I could do a lot. I could sign off, things like that. But let's go back into the therapy record. Okay, so we looked at the plan of care. Here you'll see the session notes. You'll be able to edit or click to get back into the session if you need to make changes, if it hasn't been signed or whatever, but it will be able to show you here. And then this note is already signed, so it can tell you already that you're not going to be able to make changes, but you can look at it. You can see the information here. You could add an addendum to it if you needed to, like you noticed that there was an error and you need to make changes. You could do that. It won't allow you to actually make changes to what is here, but it will allow you to make an addendum. Let's go back and finish the therapy record. Okay, so on down here, you will also see appointments, and this is all part of the therapy record. So you can see upcoming appointments. So in general, upcoming appointments are just that. This is what's been scheduled, but nothing has happened yet. Or the sessions here are actually appointments that have been completed. If we go into the guided evaluation section, which you see this over here too, these are all of the guided evaluations that have been created for that patient, student, client, or whatever, and also where they are in that process. It'll tell you the therapist that did it, what the score was, if applicable, and so on. So we're going to go on down to assessment. So I can see here that the standardized assessment was added for this student, and I can click in here to see what that score was if I wanted to. I can also click and see, okay, this form was sent to the parent, but I can see quickly that it's pending, so the parent has not completed it, or else it would say completed. And then the last thing here these are the reports. So a report is any of these things on here that have been added. So we can merge a guided evaluation, an assessment, session notes, anything that we want together to create one generalized report. We can make it as specific, or we can just hone it in on like the guided evaluation if we want to. But anyhow, this is where you could find all of your reports. You can read over them. You can make changes as long as they haven't been signed. But, I don't think normally we would have this many evaluations on any person at one time, but that's what it would look like if there was. And then it quickly tells you that this report was created for a medical or insurance audience reader. So that's something that where we were actually sending to insurance or plan or to prior authorization. Whereas if we had something like the school IEP, then that would mean that that audience is for, just exactly that. So it's written as more participation based. If you see something like failed over here, then that probably means that the evaluation was started, but it didn't have enough information to complete because, like, for instance, in order to create an abbreviated evaluation, you have to select a guided evaluation that has been completed. So in that case, it would have failed because there was no information to pull. So these other ones will tell you quickly, this is generated, failed, whatever the situation is. So that is the student area and also the therapy record. And I believe I have shown you everything on there that I intended to, and we'll see you for the next video.